Dear viewers, do you still feel fear about visiting the dentist? I understand it can be unpleasant and expensive, which is why many postpone visits until more serious problems arise. Hello, my name is Dr. Ivan Petrovich. I am a specialist in integrative dentistry and natural healing. In Moscow, I have been working in dentistry for over 35 years and now strive to help my patients reduce dental visits by sharing useful daily habits. Today, I will tell you about a man who hasn't visited the dentist for 10 years. He had no special medicines or expensive procedures, just one simple habit related to what he put in his mouth. Thanks to this, he remains healthy to this day. I also use this method myself and recommend it to many of my patients. If you watch the video until the end, you'll learn about oral care methods that are more important than brushing teeth, as well as natural ingredients that can strengthen gums. How often do you visit the dentist? Or perhaps you plan to, but keep postponing. Share your experiences in the comments. It can help others. And don't forget to like and subscribe so I can continue sharing helpful information that will reduce your hospital visits. So let's begin. We often think we go to the dentist because of tooth problems, don't we? However, in reality, many lose their teeth not because of them, but because of the condition of the gums. Let me explain in more detail. Even if the teeth are healthy, if the gums deteriorate, the teeth cannot stay in place, as it is the gums that support their roots. If you notice blood while brushing your teeth, do not ignore this signal. It may mean that the bones of the gums are starting to deteriorate. In professional terminology, this is called periodontitis. At first, there may only be bleeding, but if ignored, the gums can recede, and the bones holding the roots will weaken, leading to tooth extraction. Sounds scary, doesn't it? But in reality, more than half of the teeth lost after 60 are removed due to periodontitis rather than cavities. This happens because the gums cannot handle the strain. Another important point. With age, this process accelerates as the body's regenerative abilities decline. The blood vessels in the gums become weaker, saliva production in the mouth decreases, and dryness occurs, which promotes rapid bacterial growth. Therefore, from this moment on, let's talk about dental health as gum health. Brushing teeth is important, but it is even more important to develop individual habits to protect the gums. How many times a day do you brush your teeth? Many claim to do it 3 times a day without fail. This is wonderful, but there is one important point. A single clean brush cannot fully protect the gums. Why? The first reason is that the brush cannot reach many areas, especially the gum line, the border between the teeth and gums where many bacteria accumulate. A regular brush does not always effectively clean these hard-to-reach areas. The second reason, concerning the tongue, palate, and inner cheeks, is that these areas often remain inadequately cleaned, and they are ideal breeding grounds for bacteria. Therefore, additional tools are important for reaching the gums. For example, an interdental brush is designed to clean the hard-to-reach spaces between teeth that a regular brush cannot access. A tongue cleaner helps reduce plaque and unpleasant odor by removing bacteria from the surface of the tongue. It's also beneficial to massage the mouth, gentle rubbing or tapping on the gums, which promotes better blood circulation. You can use your fingertips, a clean cloth, or a soft cotton swab. In our clinic, we often encounter patients who complain, "I brush my teeth, but why do my gums swell?" They have just been to the dentist, yet blood has reappeared. There are many such cases, but when I add just one simple procedure, the bleeding decreases and the swelling goes away in most cases. Don't worry. Now I will tell you about the real story of a patient who hadn't visited a dentist for 10 years. He is now 74 years old, living in the province, and we've kept in touch since I worked in Moscow. He is a very responsible patient. He has been taking medication for high blood pressure for a long time and suffers from dry mouth. But what is surprising is that his gums have not swollen or bled for almost 10 years, and his teeth are not loose. Out of curiosity, I asked him how he does it. His words stuck with me. "I apply something to my gums every day." After a detailed inquiry, I learned that after brushing his teeth, he carefully rinses his mouth and then applies natural ingredients along the gum line with his fingertip or a cotton swab. That's it. At first, I doubted it would help. But in reality, he only occasionally visited the dentist. He never experienced gum inflammation, not even the initial stage of periodontitis. His routine is simple. In the morning after brushing, he rinses his mouth with warm water, lightly moistens a cotton swab in sea salt, and runs it along the gum line. Then he cleans his tongue. In the evening, he repeats the same procedure, but with coconut oil or propolis liquid, gently massaging his gums. At first, it may seem tedious, but with regularity twice a day, it becomes a habit. He didn't start with a big change, but gradually added one step at a time. I compared photographs of his gums, one from 10 years ago when he first came to me and another taken after a year of checkups. Surprisingly, there is almost no regression. The gum line is stable, without bleeding or signs of inflammation. Best of all, he hasn't lost a single tooth. At his age, it's rare to keep all natural teeth. After that, I recommended his routine to many patients, and among those over 60, many noted that gum swelling and bleeding decreased. Importantly, this routine is simple and doesn't require expensive products. Only 3 things are needed: natural ingredients to help the gums, a simple tool for application, and time twice a day. Naturally, many are curious about which natural ingredients to use for the gums, how and where to apply them. I will tell you more about this, one by one, about each of the 5 ingredients that many patients have tried for a long time and praised. I often recommended them in my practice. The first ingredient is coconut oil. In fact, it has long been used abroad for mouth rinsing called oil pulling. This oil contains lauric acid, which effectively destroys bacteria and reduces inflammation. This is especially beneficial for those with weak and often inflamed gums. If your mouth feels sticky in the mornings or has an unpleasant smell, simply apply some coconut oil or rinse with it. The method is simple. After brushing your teeth in the morning, take a small amount of oil on a cotton swab or your fingertip and gently massage along the gum line. Do not swallow, just rub well, then rinse your mouth and spit it out. The second ingredient is propolis. It is called the bee's natural antibiotic and has a strong antibacterial effect that helps soothe inflammation in the oral cavity. If you often have ulcers or sore gums, apply a small amount of pure propolis to your gums after brushing your teeth. Use a cotton swab or clean finger, but no more than once a day, especially before bed. The third ingredient is sea salt. Rock salt can also be used. In moderate amounts, salt suppresses bacteria in the oral cavity and protects small wounds on the gums. It is important to remember that one should not rub salt directly on the gums, as the sensitive mucosa may suffer. Method: dissolve some sea salt in warm water and rinse your mouth or moisten a cotton swab and wipe along the gum line. If using salt powder, apply it to a clean finger and gently press against the gums. The main point is not to rub, but to press. The fourth ingredient is eucalyptus oil. Eucalyptus is known for its beneficial properties for the respiratory system, but it also has a strong deodorizing effect for the mouth. It is the perfect choice for those concerned about bad breath. Additionally, it helps relieve minor gum inflammation. The use of oil is very simple. Choose food grade or special eucalyptus oil intended for the oral cavity. Never use oils meant for candles or fragrances. Apply the oil to a clean cotton swab and gently spread it along the gums. If your skin is sensitive, dilute 1 or 2 drops of oil in warm water and use it for rinsing. The fifth ingredient is green tea extract. The catechins in green tea can suppress bacteria in the oral cavity, and polyphenols help those with gums prone to swelling. Brew strong green tea, let it cool to a warm state, and use it for rinsing the mouth or apply it with a cotton swab to wipe the gum line. All 5 ingredients are easily available for purchase online at reasonable prices. The main thing is to add this procedure to your morning and evening routine for 3 to 5 minutes a day, and your gum health will significantly improve. Among the patients who followed this advice for 3 months or more, not only did the bleeding gums stop, but the unpleasant breath significantly decreased. A 2-in-1 benefit. Try at least one of these 5 methods today. It's not difficult. The hand will remember the movement, the mouth will react, and soon it will become a part of your life and a habit. Now let's talk about how to apply these methods in practice. Timing, frequency, and caution. First, when is the best time to apply them? I recommend doing this twice a day, in the morning and evening after brushing your teeth. In the morning, after sleep, the number of bacteria in the oral cavity is at its maximum. Natural ingredients quickly neutralize this environment, while at night saliva production decreases, drying the mouth and activating bacteria. Evening routines help protect gums and prevent inflammatory processes. First, it's essential to apply products correctly. Start with thorough toothbrushing. If there are food particles or plaque left in the mouth, even the highest quality ingredients will not be effective. Use a clean cotton swab or your finger. If you choose your finger, wash it and trim your nails to avoid gum irritation. Apply the product along the gum line, pressing lightly, avoiding heavy pressure and friction to prevent tissue damage. A small amount is enough to achieve the effect. The mouth absorbs quickly, so a lot is not needed. As for the frequency of use, it depends on the specific ingredient. Coconut oil can be used once or twice a day for weakened gums, in the morning and evening. Propolis is recommended to be applied only once before sleep. If the gums are severely inflamed, avoid its use. Sea salt is suitable for rinsing once a day, preferably in the morning. Apply treatments every 2 days, and eucalyptus oil should be used 2 to 3 times a week. Every day, only diluted formulas can be used. Green tea extract is best applied for rinsing twice a day, and for application, a patch test should be conducted first, followed by once a day. The key is consistency. If you start using the remedies for 2 days and stop, you will notice no changes. Be careful. If the gums are damaged or inflamed, even natural components can cause discomfort, so it's best to stop and consult a specialist. Natural remedies can be useful for maintaining oral health and help in treating diseases. When choosing products, it is important to use only those intended for food or dental use, especially essential oils. Industrial products or flavorings can cause serious side effects, so check the composition. Everything I've mentioned isn't difficult. Just spend a couple of minutes twice a day and you'll notice changes in your oral health. People who followed these recommendations for 2 to 4 weeks reported reduced bleeding and unpleasant odors, as well as fewer visits to the dentist. I advise those listening to start this evening with one of the remedies after brushing their teeth. In the end, I will summarize the reasons for gum destruction and habits that will help in prevention. To keep gums healthy, remember a few important recommendations. First, brush your teeth at least twice a day. Even 2 minutes matter, but don't forget to pay attention to the gum line, otherwise plaque will remain. Ensure the brush is soft and does not apply too much pressure on the gums to avoid damage. Secondly, do not allow prolonged dryness in the mouth. She weakens the gums, and bacteria begin to multiply. Drink water often and in small portions to avoid dehydration, especially for elderly people taking medications like diuretics. Thirdly, be careful with hard and tough food. Squids or dry snacks can heavily burden weakened gums. Prefer soft food to avoid injuring the gums. Fourthly, pay attention to dentures and implants. Food can get stuck between them, leading to inflammation, so wash them daily and see a dentist at least once a month. Fifth, manage your stress and support your immunity. Gums can become inflamed with a weakened immune system, so it is important to get enough sleep, manage stress levels, and consume foods rich in vitamin C and antioxidants. By following these 5 recommendations, you can maintain your gum health for 10 or more years without the need for frequent dental visits. Dear viewers, as I mentioned at the very beginning, in dentistry, teeth are most often removed due to gum problems rather than the condition of the teeth themselves. Weak gums cannot hold healthy teeth, causing them to become loose or fall out. However, gums can recover with proper care. A 3-minute routine twice a day using natural ingredients will serve as excellent prevention for teeth and gums for the next decade. It's never too late to start with one simple step. This will make visits to the dentist more comfortable and less necessary. If this video was helpful to you, please like it. Share your secrets for oral care or what you have tried in the comments. This could help others. My name is Dr. Ivan Petrovich. I study natural oral healing in the field of integrative dentistry. See you in the next video, where we will talk about healthy gums and a fulfilling life. Thank you.